Hello and welcome to our channel Health Calp. Today we're diving into some crucial updates about vitamin D that everyone should know. Recent research has prompted new guidelines on vitamin D intake, and these changes can have a significant impact on your overall health. So stick with us as we explore what's new, why it matters, and how you can incorporate these updates into your daily routine. But before we begin, don't forget to like this video and subscribe to our channel Health Calp for more health tips and wellness insights. What's vitamin D and why is it important? Vitamin D is essential for our overall health, primarily because it helps our body absorb calcium, which is critical for maintaining healthy bones. Beyond that, it supports the immune system, helps with muscle function, and has been linked to mental health and mood regulation. Without adequate vitamin D, you might face an increased risk of osteoporosis, weakened immunity, and even mood disorders like depression. What's changed in the new guidelines? The recent update on vitamin D guidelines comes after growing research into how much of this vitamin we really need for optimal health. Here are the key changes. Increased recommended daily intake. Many experts now recommend higher levels of vitamin D intake for both adults and children. For most adults, the new recommendation is about 600 to 800 IU per day, with some experts suggesting even higher amounts depending on your lifestyle, age, and medical conditions. Age-specific needs. The updated guidelines emphasize that older adults may need more vitamin D due to the natural decline in the skin's ability to synthesize the vitamin from sunlight as we age. If you're over 65, your intake should likely be closer to 800 to 1000 IU daily. New focus on sunlight. Sunlight exposure is still one of the most efficient ways to get your vitamin D, but the guidelines now stress the importance of balancing sun exposure with skin protection. The ideal exposure time varies by location and skin type, but the guidelines suggest getting sunlight for about 15 to 30 minutes a few times a week, while ensuring you avoid the risk of skin damage. Supplements for high-risk groups. The new guidelines highlight that certain groups of people are more at risk of vitamin D deficiency. These include those with darker skin, people who live in northern latitudes, and individuals who spend most of their time indoors. If you fall into one of these categories, consider vitamin D supplements as part of your routine, but always consult with your doctor before starting any supplementation. Why these new guidelines matter. The updated recommendations are essential because vitamin D deficiency is a growing concern worldwide. This deficiency can contribute to various health problems, including bone health issues. Insufficient vitamin D can lead to bone softening or osteomalacia in adults and rickets in children. These conditions can cause bone pain and deformities. Weak immune system. Low levels of vitamin D can make you more susceptible to infections, especially during the winter months when your sun exposure is naturally lower. Increased risk of chronic diseases. Emerging studies suggest that inadequate vitamin D might be linked to a higher risk of chronic illnesses, such as heart disease, diabetes, and even certain cancers. Following the new guidelines ensures that you are getting enough vitamin D to support these crucial functions in your body and reduce your risk of deficiencies. How to make sure you're getting enough vitamin D. Here are some tips to help you meet the new vitamin D guidelines. 1. Get outside. Make sure you're getting regular sunlight exposure. Try to spend at least 15 minutes outdoors a few times a week, especially during the morning or late afternoon when the sun is less intense. Incorporate vitamin D-rich foods. While sunlight is a great source of vitamin D, you can also boost your intake through your diet. Foods like fatty fish, such as salmon and mackerel, egg yolks, fortified milk, and cereals are excellent sources of vitamin D. Consider supplements. If you have limited sun exposure or are part of a high-risk group, you might need to take a vitamin D supplement. Look for supplements that contain vitamin D3, as it is more effective at raising blood levels of the vitamin compared to D2. Again, consult with your doctor to determine the appropriate dosage for you. Check your vitamin D levels. Regular blood tests can help you understand if you're meeting your vitamin D needs. This is especially important for individuals at risk of deficiency. Your healthcare provider can guide you on how to keep your vitamin D levels in the optimal range. The new vitamin D guidelines reflect the latest understanding of how crucial this vitamin is for maintaining good health. By following these recommendations, you can ensure that your body gets the right amount of vitamin D to support strong bones, a healthy immune system, and overall well-being. That's all for today's video. If you found this information helpful, make sure to give this video a thumbs up, share it with your friends, and subscribe to our channel Health Calp for more health and wellness updates. We upload new content every week, so stay tuned for more valuable insights. Thank you for watching and stay healthy.